Across Africa, countries are experimenting with the drone technology to deliver on-demand emergency medical supplies to remote areas. The use of drones appears to save lives. Take a look. For an aspiring drone pilot, racing unmanned aerial vehicles in my neighborhood or empty parking lots is a new hobby, and I still have a lot to learn. Perhaps I should not quit my day job as a journalist anytime soon. In the United States, 3 main steps must be taken to become a certified commercial drone pilot. Step 1, you must learn the rules as required by the Federal Aviation Administration. Step 2, you must pass the knowledge test required by the FAA, and Step 3, you must register your drone with the FAA. A San Francisco, California-based tech firm, Zipline, is changing the way people use drones. The company has a fleet of drones that carry medical supplies to remote areas in Africa. Earlier this month, Ghana became the second African country after Rwanda to launch a fleet of drones carrying medical supplies to remote areas. The drones are part of an ambitious plan to solve the problem of medical access in a country with poor roads.
With the Zipline and its provision of the drone technology, we believe very much that if it happens that we have to bring things on an emergency basis, it's going to be much easier for us. Within a very short time, like where we find ourselves in a new Tafu government hospital, within 30 minutes you have these products delivered to you.
Zipline is quickly becoming one of the world's largest independent logistics networks, providing nearly 13 million people with instant access to essential medicines and revolutionizing access to healthcare with a cost-effective drone delivery network. Zipline's drones have been flying test runs with blood and vaccines at the main drone base in Omenako, 70 kilometers north of Accra, one of the company's 4 distribution centers. Zipline says 3 other main sites should be up and running by the end of 2019.
When people are in urgent need, when their life is on the line, and the hospital might not have the blood or medicine they need to stay alive, we're able to get that medicine to them in 15 to 20 minutes by sending a drone and airdropping a package of medicine to the hospital.
Zipline began its African journey in Rwanda in 2016, delivering blood and medicine in Rwanda. That success has inspired other African countries to tap into the technology. In 2016, Malawi's government launched Africa's first drone air corridor to provide a controlled platform for drones to deliver needed services to communities. UNICEF Malawi primarily supports the testing corridor as a pilot project using unmanned aircraft systems for transporting dried blood samples for the early diagnosis of HIV in infants. In Madagascar, drones fly blood and laboratory materials from rural villages to a research station for testing. The drones help doctors speed up the identification of disease in patients and make quick deliveries of vaccines. Some commercial drones are already being used to monitor crops, inspect bridges and transmission lines, and assist firefighters and police officers and filmmakers. As for Zipline's future, the sky is the limit.